My name is Dave Ashheim. I have two great panelists, Rebecca and Trish. We'll introduce them in 2 seconds. Like I said, we're recording this webinar. This is a free forum. So this is your chance to ask Trish, who is an expert residing in Colorado, and also Rebecca, who is at the city of Golden, coincidentally in Colorado. And Rebecca's been thinking about these issues, she and her team, and have actually implemented our vaccine tracking solution. And ask questions whenever they pop up. Kim and Molly are our marketing gurus. They'll be feeding them to us. So this is just a great time to try to ask questions. We're going to try to get this done in 30 minutes, 35 minutes or so, but we'll stick around for as long as you want. Rebecca, why don't you introduce yourself?
Hi, I'm Rebecca Glover. I'm an HR generalist with the City of Golden. My primary focus is benefits, which is why I've been tasked with handling the vaccine information since it is medical information.
Lucky you that you've got that responsibility. It's a resume booster. All right. And Trish has been a guest speaker twice, I think, and we've relied on her quite a bit to provide our expertise. Trish, tell everybody that hasn't met you in a webinar a little bit about you and your organization, the Safety Association.
Thanks, Dave. Yeah, thanks for inviting me back. Actually, I always enjoy hearing from your members and attendees on your webinars. My name is Trish Ennis. I am the Executive Director for the Colorado Safety Association, and we're a small nonprofit safety training and consulting organization in Denver. Been around as a nonprofit for about 52 years. And my background is pretty varied. I've worked in the construction industry, the insurance industry. I worked at a zoo for a while, did a bunch of consulting for zoos around the country, and now I'm the executive director here for CSA. So it's fun.
Excellent.
It's a fun role.
Fun and very needy. You've never been in more demand, Trish, than you are right now, probably. All right, so this you can see on the slide. We're going to get some hands-on experience from Rebecca, who launched her tracking system maybe a month or so ago, maybe less. And Trish, we're going to put on the spot big time, everybody. So prepare your really hard questions for Trish. And I'll start off by just telling you a little bit about our company and how we're involved in this. All right. Our company, Engage Buy Sell, has been around for about 14 years, and we have about 3,000 clients or so helping organizations, mostly with HR and training solutions, but we have a breadth of other solutions. About 6 or 7 months or so ago, a lot of our HR clients were saying, hey, you do provide all these great mobile solutions and text messaging things. What are you going to do for us regarding tracking these vaccines? And we didn't realize it was going to get to the point where it is now, where there are OSHA guidelines and Biden mandates and all kinds of crazy things. So we polled our clients and they came back and said, these are the things that we want. We want something better than an Excel spreadsheet or pen and paper, because we don't know how long we've got to keep this information. And we're not really sure about the whole HIPAA thing. So we want to outsource this. So they came to us and said, let's see if you guys can build not an app, but something that looks like an app that's a web-based tool where there's no cookies, no one's being tracked, and also allow people to fill out this information on a computer, a tablet, or a PC. And of course, one where I can click a couple of buttons and see analytics. And then the interesting thing that we heard was they were looking for a way to use text messaging to get people's attention, because not everybody reads email. And many of the companies, in fact, probably on our webinar today, they have a workforce that may not even have a corporate email address. So that's really what we built. And if we go to the next slide, this is where you all can take out your phone and either send a text message, or what's even easier, just scan that QR code and let me know when you scan it. You know, if you haven't scanned a QR code before, you just take your phone, go to the camera, hold it up, and you will have a little pop up like right there. And you just tap that and you'll land on a page. And this is just an example of kind of a sample vaccine tracker system. I think, Rebecca, yours is probably looking kind of like this too. Our platform allows clients to totally customize the look and feel, all of the questions, all the reporting you can get. So just think about this as a way that people can click a link that you email them, or they can scan a code, or you can text them info, and then they just fill out whatever questions you want to collect, and then that's available on the back end. So that's been our response to that. We've been HIPAA certified by a third party, and a lot of clients are using text messaging to kind of drop that in. And we have great reports now, and we'll have in another 2 or 3 weeks, all kinds of automatic reports that can be sent to people. So that's a little bit about how our tracker works. Let's move on to my chat with Rebecca. So Rebecca, you and I and your team met, it wasn't that long ago, maybe 3 weeks or so ago. And what was the thought process from behind the city of Golden to begin trying to track this? What went on behind the scenes in the conference rooms?
Yeah, so we had started hearing murmurings that Jefferson County was going to implement some type of vaccine mandate for all of the cities that were in Jefferson County. So we were like, okay, we need to implement a solution. We have a lot of employees who are not computer-based, so we didn't really want to rely on email or Excel. And so what really drew us to this tool was the texting portion of it. So that way we could text employees to remind them for their weekly tests if they were not vaccinated, and they could just text in their vaccination status as well.
Did somebody in the county or the state tell you you had to do this by a certain date? Because some folks we're talking to are like, well, I'm just going to wait as long as I can. What was the thought process going on with you guys?
So our city manager sits in a biweekly call with Jefferson County. So they had told him that it was probably going to happen here soon. So we just wanted to get ahead of it and get a tool in place. They recently put it into action. So as of November 1st, that's our deadline to be compliant. But we're well ahead of that, which is exciting.
All right. All right. Next slide, Molly. Tell us a little bit about, you mentioned that not everybody, does everybody have an email account with you folks, or some people don't have email with the City of Golden?
So all of our full-time employees have email addresses, and some of our level 2 part-times do, but most of our level 1 part-time, as well as our seasonal and our volunteer firefighters, do not have an email address with the city.
Mm-hmm. And are you going to ask them, or you are asking them to fill out this? Yeah. So you're asking basically everybody that's affiliated. Older workforce, younger, union, not, and what's kind of the, or just everything mix?
No union, but our age demographic is from 18 all the way up to retirement age, because we do have a pretty vast array of jobs.
Your city is politically one way or another, or right down the middle typically?
I'd say right down the middle.
Right down the middle. And how many people, contractors, employees, vendors are you?
When we're at full capacity during the summer, we're around 700 employees.
Wow. Okay. That's a lot.
Mm-hmm.
When you sent this out, how many folks have completed the information? How was the rollout gone, and kind of explain to us how you did roll it out?
Yeah, so we initially rolled it out to our childcare workers because they were the first ones who were under a requirement to show their vaccination status or submit to weekly testing. and we got 100% of them within a couple
Wow.
days.
That's kind of surprising. You would
Yeah.
think that. And from those folks, or maybe in general, did you get much pushback? Like, why are you asking? Or it was just because everybody's been reading the news, they just knew.
Our city manager had put out a video 2 weeks before saying, hey guys, this is coming. So people weren't surprised by this, which helped a lot. And I think most people are kind of like, this is just the world we're living in right now. And we were definitely not the first to implement this, which helped a lot. And we have management team buy-in, which helps a lot too, because they're working with their folks too.
Is that video something that's public or private? I would guess some of the folks that are listening would love to see how something is implemented. So maybe after this, you could see whether that's something that could be shared with folks that would be interested in seeing how messaging is created around this, because that's not so easy.
Yeah, I'd have to work with our communications team to see.
That would be outstanding. The video and the messaging, was it was it a hard thumb, like you've got to do this, or please do this, or we would like you to, or what's kind of the theme of how did you get people co-opted into taking their phone out and actually doing this?
Yeah, it was a mix of, we have to do this, it's been mandated, and we empathize that this is not what we wanted to do. If it was up to us, we would not be tracking this information, but it's above our control at this point. And we empathize that, we were hoping to be out of the pandemic by now, and we're still in it. And no one wants to be here, but this is where we are. So if you can help us, this would make it a lot smoother.
That's a really good strategy, is to kind of co-opt people into it, not saying, look, this is because some companies I'm reading about are basically saying this is coming from the top and you're going to do it or you're going to lose your job. That doesn't sound like that was the message in Golden at all. It was, look, we don't have a choice. That's interesting. All right, let's look at the next slide about data. Some folks we're talking to are asking a million questions. Partial vaccination. If you're not vaccinated, pick in a drop down why I'm not vaccinated. What kinds of questions did you ask, and what were the reasons that you didn't ask a million questions?
Yeah, so we have, are you vaccinated? If yes, what were the 2 dates? What shot did you get? Upload either a picture of the card, or the My Colorado app has a way to show your vaccination status. We did not ask partially vaccinated, because you're either vaccinated or you're not.
Okay.
And so for the unvaccinated folks, and we said that you're unvaccinated if it's been less than 2 weeks since your last dose, even if you have gotten the shot. Just when are you planning on getting tested? What was your last test results?
So you didn't want to know or ask, why is it that I'm not vaccinated? Is it for religious reasons, whatever? That's not something you guys really went into depth on.
No, we put in the FAQs, if you have an exemption to getting the vaccine or getting tested, to work with HR directly for that accommodation. But that's not something we felt that we needed to keep track in a database.
What were your results, if you can share? And if you can't, that's okay. Just like, was it half vaccinated, half not vaccinated? I mean, anything that is shareable in terms of stats?
For our daycare group, we were at like 95% vaccinated.
Wow.
Results are still trickling in for the general population, but we're estimating 75 to 80% are vaccinated based on anecdotal information.
Okay. The folks that are not, are you asking them every so many weeks or days to go get a COVID test and submit that, or what's your?
The JEFCA mandate is that they need to submit to weekly testing.
Weekly testing. So then do you then send out the link and remind someone like me to go ahead and get that done?
We'll text them on Mondays.
Oh, all right.
Yeah, we'll get the
That's
group. We're getting the group together in the platform, and then we're gonna have a text that goes out every Monday to remind everyone you need to have your results in by Friday at noon.
and this tool that we built that you're using has a way that I can take a picture of a result or upload a
Yes.
PDF. So that's handy so that it can go right in. So they're not texting you personally this
Right.
private information. Right.
Yeah, and we're requiring everyone to submit proof, so the picture or document.
Got it. Got it. Okay. Any questions before we move on to put Trish on the spot? Hope you're ready, Trish. Before we move on, anything that you folks want to ask Rebecca, since she is not in the hot seat, but right in the seat, kind of working this from the HR point of view? If there are, put them in the chat window.
I have a question for Rebecca. Can I ask?
Yes, of course, Trish.
For your weekly testing for your employees who choose not to get vaccinated for whatever reasons, are you paying for the tests and for their time to get tested? How are you handling that piece of it?
We're paying for the time. So if it puts them into overtime, we're paying for that. Currently, we're not paying for tests. We're providing resources to where all the free testing is in our area.
Got it. And there's a lot of free testing. And do you have a requirement that it's PCR versus antigen, or you just require a test?
The mandate allows for both.
Okay.
We've got a question, Rebecca. Is there a way to get notified if the person is, let's say, late? I know that's a feature that our engineers are building now so that the HR person can automatically send a text to that person and a note to Rebecca. That's probably a week or two from completion. That'll be really slick, I think, Rebecca, when that's done, so that you don't have to even look at this. But now my guess is you're just looking at the unvaccinated people and just going down our report and just seeing and doing it manually.
That's correct.
Yeah, but that will be added in a week or two. That was a great question. How about some other questions? Anything else? Those who have had COVID, that's a good one. If you tell us a little bit about that, Rebecca. If I say I'm not vaccinated, but I have COVID, what's happening?
Yeah, I mean, our get out of jail free card right now, as the mandate says, that's not accepted. You're either vaccinated or you're not. Antibodies are not sufficient.
Okay. And that's from a printed mandate that you have seen. Okay. All right. Well, then that's what you would show.
Yeah.
Is that a state thing, Rebecca or Trish, or is that a federal thing?
It's Jefferson County right now is
Jefferson
what we're
County.
under.
All right, good. Great. And Gloria, yes, we're going to send a copy of the presentation tomorrow to everybody. All right. Well, thanks a lot, Rebecca. We're going to get back to you in a second. Let's chat with Trish for a second. Trish, Molly, and Kim and I, when we were preparing for this webinar, we envisioned 80 roads all crisscrossing. So our designer came up with this. You've got New York rules, Tennessee, California. Everybody's got different rules going on. It seems like every day it's getting more and more confusing. So good for Rebecca. Yay, Rebecca, for you to just say, we're going to do this. It's not going to hurt anybody to do it. We know we're going to be required to do it, but I think a lot of people on the call today and that will be listening to this are probably kind of looking at this maze and saying, well, I don't even know where I am on this maze. And because I got employees in California and some in Florida, but I don't know what to do. So Trish, give us some high level, up-to-date advice on where are we with the mandates, whether they're state or federal or OSHA?
That's a good question. I think this graphic kind of demonstrates where we are. Surprisingly, I noticed we have some people from Texas on the call, and this reminds me of some of the interchanges I've driven through in Texas. They're like huge and lots of highways layered on top of each other going in every direction. And I think that that's a very good picture of where we are. You know, just interestingly, OSHA has been working on their emergency temporary standard, the ETS, and that's going to be the federal guideline for vaccines and the pandemic response. That actually just got submitted to the Office of Management and Budget, essentially the White House, yesterday. So interesting timing on that. The way these ETS programs work is that they can only be in effect for 6 months after they're approved. And then they either have to sunset it or potentially replace it with another ETS, I guess, but it's a 6-month standard. So it'll be curious to see what happens with that. But I think when you ask, Rebecca, is that a federal or a Colorado standard that you're falling under? This graphic also shows you've got OSHA that's coming into play. You've got your state mandates, you've got your county mandates, you've got your federal mandate. You have multiple mandates. And so how you make your decision kind of depends on the jurisdiction you're in, which makes it so much more confusing. Florida just filed suit about mandatory vaccine and mask mandates and saying that you can't do it. And so you've got some states that are in conflict with the federal, and as an employer, how do you navigate that maze? That's a challenge. I can't answer that question. I don't think anyone really can. You kind of have to do your risk assessment and decide where you're going to fall.
Does OSHA rule over every organization from nonprofits to cities like Rebecca, or is it just certain kinds of SIC codes that it's controlling?
So again, that's a kind of a bowl of spaghetti. We have about 29, I think there's 29 federal OSHA states, and they are over non-government employees. So for the most part, OSHA, the whole theory of government doesn't regulate government kind of a thing, with the exception, I think, of the Postal Service and the Park Service and a couple of federal agencies that have opted to go under OSHA rule. For the most part, the federal government is over private employers. That would include me as a nonprofit. I'm a private employer. If you're a public employer, but you have a foundation hiring and managing your employees, or a private entity managing your employees, like some of the zoos I've worked with, then those employees work for that private entity, not the city or the government. So they would fall under OSHA jurisdiction. So you have to understand kind of who your employer is. In Colorado, and I believe I'm right, Rebecca, tell me if I'm right about this, but municipalities and public entities are not under OSHA jurisdiction. So they've got their own liability to manage, but it's not federal regulation from a safety and health standpoint that oversees them. Then you've got the state plan states, and those they vary. Some state plan states, I believe in Tennessee, for example, that the state plan OSHA oversees federal and municipal employees. And so it's going to vary depending, again, on your jurisdiction. You kind of have to know what the structure is where you're operating. So.
And this is not something, unfortunately, that an HR person can just ask their local attorney necessarily, because they may not have that information. I think last time we had you on, Trish, you gave us quite a few links that that maybe we can get fresh links and fresh information. So everybody, when we send out our information tomorrow, will include as much information that Trish has got, everything from SHRM links to some OSHA links as well.
Right.
There's a great question from Rebecca Johnson to Rebecca that I'm going to save for a second, but I'm going to ask you, Trish, the question from Gerald Beckman. Maybe if you can see that in the chat, you can read it out loud and take a crack at that. That is, one of many questions people are kind of wondering about.
The legal liability.
The legal liability.
Yeah.
If I try to bring people back to work and someone gets sick, but if I bring people back to work and I implemented this vaccine tracking system, does that help my case, or what's the? Right. Where do we stand with that?
Yeah, I mean, that's actually a really good question, and it's a hard one to answer because it's so multifaceted. So the legal liability of implementing a tracking system, I think in that case, you have to be very mindful about what you're tracking and how you're tracking it. So for example, if you are tracking, let's say the OSHA emergency temporary standard goes into place and you're tracking these vaccine standards as occupational exposure data and medical record data, the tracking, the employee medical record tracking related to workplace exposures is length of employment plus 30 years. And so you have to understand what you're gathering, how you're using it, and how you're going to keep that record keeping in place for the time that you have to keep it in place. So that's one thing. Then there's the whole EEOC question, right? And the disabilities question, which is, if you ask if an employee is vaccinated or not, that's one question. If you ask them why they didn't receive a vaccine, now you're stepping into something that might reveal a disability, and then you've got a whole different layer of tracking, right? So you have to be careful about that. And then when it says wrongful termination or failed tracking, safe place to work, I think a lot of the safe place to work concern is why some employers are moving forward with the vaccine requirement, even if it's not a mandate, right? Because they want to provide not only a safe place for their employees to work, as much information as they're using to sort of gauge that, but also for their clients and their customers. So that's a challenge. If it's wrongful termination, I think there are ways to navigate that by the reasonable accommodation that you can come up with if somebody doesn't choose to get vaccinated or isn't going to get vaccinated. And I think Rebecca has some of those things in place, right? The weekly test requirement is a reasonable accommodation for someone who doesn't want to get vaccinated. You can also, there is, I think, case study, or what's the term where you have sort of it's out there as precedent that giving someone time off without pay is also a reasonable accommodation if you can't find another way to accommodate them. So I think that really good question by Gerald is there's lots of different answers to different pieces of that question. And then back to his, natural immunity, Jefferson County here in Colorado has said that someone who has natural antibodies, that doesn't meet the standard of a vaccine. And that is the same in all the mandates that I've seen, including the emergency temporary standard. So however they came up with that rule, that is the reality that we're working with, is that none of those standards are considering immunity as, equal to a vaccine. That was a lot of answers, sorry.
No, it's an impossible question because it's so multifaceted, like you said.
Right.
What agency or who will be actually checking for compliance? Because the penalties are unclear, but from what I've read, they could be, I might lose my government contract, or I might be the unlucky one that 1 out of 1,000 gets a knock on the door from the OSHA auditor. What are you hearing about compliance and how it's going to be checked?
So right now with compliance, they're saying, will there be penalties from OSHA, for example? And it's unclear at this point because the ETS hasn't been issued, so we don't really have all the guidance on that. So OSHA will certainly be one agency checking for compliance in the event that there is, that the emergency temporary standard goes into place. But I will tell you, just like any other OSHA action, there aren't enough compliance officers to actually respond to everything they hear about. So it would have to be somewhat egregious or a workplace safety concern that rises to the level of a local office going out and opening an inspection. Right? Discussing penalties and lost revenue possibilities, that's the same thing as far as whether it will be a fine or, to your point, Dave, loss of a government contract. That's a reality. A lot of these in Colorado, government, any contractor working in a medical facility in the state has to show proof of vaccination. And I know I'm speaking with some knowledge that the AGC, Association of General Contractors, I believe, has filed suit because for construction companies in particular, they have to to bid, they have to propose a price for a job, right? They bid on these projects and they get awarded based on their financial bid that they put in. That's well ahead of construction starting. And what these contractors are facing now are supply chain issues, material costs have escalated. And now on top of this, they have a minimal amount of time to actually come into compliance, and the added expense of giving their employees time off to go get vaccines or tested or whatever. All of those costs are piled on top of this estimate for the job that they submitted and got awarded the job for. So how do they recover those costs? And that's a lost revenue, certainly, for someone in that kind of a situation.
Well, and I spoke with an HR manager yesterday, Rebecca and Trish, who works for a large franchise company, and they provide security guards and kind of $20, $15 an hour people. And they know they have to comply, and they're going to use this vaccine tracker, but they're thinking it's just going to make it harder and harder until it's such a norm to retain people, because some people just don't want to do it. So they'll go try to find a job, maybe at a small company where it's under 100 employees, where they don't have to comply. So it's just it's creating a huge burden for the workforce. But from an HR point of view, it seems like, I think the movement is what Rebecca has done, which is it's coming down one way or another. And we don't want to risk either what Gerald was kind of indicating regarding suits and or issues with losing contracts.
Or the safe place to work.
Or
right?
The safe place to work.
And that's the argument that the companies with 100 or more employees are saying, well, why is it an unsafe place to work for us if we don't have everyone vaccinated, but it's not unsafe for someone with 55 employees or 99 or 10, right?
Yep.
And so the standard that OSHA is putting in their emergency temporary ETS is they feel like it's arbitrary, because how do you say it's a risk for someone in this category but not this one? And so it'll be interesting to see what the lawsuits show.
We had a question earlier from Rebecca Johnson directed at our Rebecca about how much extra time is this adding to your day, 500 to 800 people on your list, Rebecca, to review the non-vaccinated and look to see that that's a real card and look to see that it's a negative COVID test. Can you give the audience a bit of an idea, Rebecca, how much has that added in terms of an hourly burden to you?
It hasn't added too much. Thankfully, we do have a large vaccinated population, which helps a lot too. I would say maybe a couple extra hours a week, just in terms of for the non-compliant people.
Okay.
The people who are getting their weekly tests, it's easy as, yep, they did it. Yep, this looks good. Maybe a couple minutes. It's more the ones who we need to follow up and be like, hey, you haven't gotten your weekly test. You can't come to work next week until we get your weekly test. That's where it becomes burdensome. But I think that's outside of any tracking system you have. That's just going to be the most time consuming part.
And it's going to continue. I mean, even if the whole thing were automated, you still have hey, you can't come to work. You can come to work next Wednesday or however that is. Gerald asked a question about people that work from home. Trish, what's the thought process from OSHA and others on that?
So the current advisement I've seen on that one is that someone who works at home 100% of the time can be exempt if they never come into the office, right? If they have to come in once a week or occasionally, they would fall under the same guideline. Do you agree with that, Rebecca? Is that what you guys are?
Yep.
So.
And thanks for that, Trish. And one more follow-up from Gerald. You'll see it in the chat about immigrants. Have you heard anything to that notion?
I have not. I mean, I think if they're requiring employees to have a vaccine, it's going to extend to everyone. They're not going to give someone a pass. They came in from another country.
For those organizations that might be too small, what's your advice? Should they still go ahead and ask people to fill out the the forms and kind of self check? What do you think, Trish?
As far as tracking vaccines?
Well, tracking and or saying, look, this is going to make our workplace a little safer for the people that are. What's your thought on that?
That I think that's a really good question. I'm not sure I have a 100% answer. I think it's going to vary by, the industry you're in. So here we do a lot of training and we're exposed to a lot of people outside of our organization. So a safety concern for my staff is that they be vaccinated so that they don't get sick from the exposure. If you can't accommodate, the distancing, the mask wearing, a lot of people end up getting vaccinated, I think, just because it's so burdensome to do everything you have to do to be able to go to work if you're not, right? They finally cave in and say, okay, whatever, I'm gonna do it. There's a large refinery here in Colorado. I just got an email the other day. They're requiring any subcontractor employee who comes on their site who's not vaccinated to be tested every 72 hours.
Oh my gosh.
And so what do you do there? Do you quit your job or do you get vaccinated or do you just do the every 72 hours? That's a lot of swab in the nose time there every 72 hours, So I think that if you have a lot of work from home people and they're alternating time in the office and you can socially distance, maybe it's not as big of a concern as where you're all piled in a cube world together and people are in the lunchroom and they're interacting,
Yeah. Rebecca, do you think that implementing this policy and the weekly testing for those that are unvaccinated, have you seen a few more people move off the unvaccinated to the vaccinated?
Yeah, I think some people, when our city manager first put out that video, got vaccinated just because they saw the writing on the wall. And honestly, especially in Colorado, it's becoming more and more difficult to go anywhere without being vaccinated. So I think it's just, even outside of work, it's just becoming the norm everywhere.
I see. So it's kind of becoming the norm, as well as the burden, like Trish was saying, of having weekly swabbing. It's like, okay, enough is enough. I will go get vaccinated. And has this last point here, Rebecca, been something that you've heard, that people are thankful that more people are vaccinated because it might be a little safer work environment, or that hasn't popped up?
It's popped up, but we've also gotten the other end of the spectrum too. So
yeah, I'm sure. Okay. All right. Well, we're nearing the end here, and we'll ask this question about, what kind of resources, Trish? You're going to send us some links and we'll include those. In general, the folks that are on the call are from probably all 50 states. Where should they go, basically?
So I would say the news media is probably not your best source.
Okay.
Regardless of your leaning, you're going to find, we have the thing we call confirmation bias. People are going to be able to find the information that they are looking to support their argument, even unconsciously. I see both ends of the spectrum when I read the news. So I don't really feel that it's the best unbiased source. So I would go to some of the organizations that provide just the facts so that you can kind of make up your own decision. And I still think the Society for Human Resource Management, so SHRM, they've got some good information. There's varying levels of trust with some of the government agencies like NIOSH and the CDC. As a safety and health professional, I personally like some of the publications I get from there, but some people feel that that's a government tainted sort of source. So maybe that's not the place they want to go. Fisher Phillips, full disclosure, I have one of my board members works for Fisher Phillips law firm, but I've watched her do presentations for people and she's very nonpartisan and objective in the way that Fisher Phillips presents their information. And they have lots of really great documents out there, even linked through SHRM. So it's not just CSA pushing Fisher Phillips, it's out there in the bigger world. And they've got sample documents and templates and all kinds of information. They have a whole COVID sort of portal where you can download for free a lot of their information. And then the American Industrial Hygiene Association, quite frankly, AIHA, they have a lot of really good information for free on their website, as well as the National Safety Council, I think, has some stuff. So I'll send you links, and a lot of those groups are pretty unbiased in the way they present their information.
But probably Facebook or Instagram are not the places you're suggesting we all go to.
Yeah, I mean, I don't know. Yeah, probably not.
Maybe to check for cat
Any
videos.
Social media site is going to be influenced by the people posting. So
I know. We're nearing wrapping up. Rebecca, advice for your HR friends that are on this call. What would you say to people here? Like, well, what's the takeaway that you'd like them to walk away with?
If you think a mandate's coming, it's better to get in front of it than to wait till the 9th hour.
Yeah, I also think the way you positioned it as, look, this is being mandated. Don't shoot the messenger here. This is just the way it is. Kind of not a strong arm method. And Trish, you were saying to us earlier that the OSHA guideline or ETA is coming tomorrow. So this is a train that's definitely going to be coming into the station. This is not like a maybe. The mandates are coming for most of the country, like it or not, right?
Right. Well, and the OSHA, they're going to publish it between the 18th and the 20th of October is the expected timeline, and that there will be probably enforcement beginning after like December 1st. So we're expecting it by the end of the month, and then potentially November it's going to go into effect for some of the state plans, and by December 1st they would start enforcing. And again, it's going to be a 6-month emergency standard. It takes OSHA 10 years to promulgate a new standard. So when this expires, it's not going to be automatically replaced by a permanent standard. So they're either going to have to let it expire or try and extend it or replace it with a similar thing. So it's really curious to see what happens with it.
It is. Yeah. Well, we will wrap up here. I'll make a plug for our service. We've built this vaccine tracking mobile service that's got text messaging associated with it, where employees can take pictures of their card or of their report that they got their COVID test results. It's a pretty seamless installation, takes probably 3 or 4 days to kind of get this up and going. So if any of you are thinking, okay, I need to get going, email me. We have 3 or 4 professionals that can help you sort this through and create your own little mobile account like we've done with Rebecca. And both Rebecca and Trish, I think, would welcome questions that you've got. So there are their emails. And hopefully you've learned a little bit from this discussion today. Rebecca, thanks for implementing a solution and helping your workforce navigate this. And Trish, you're always very insightful into the crazy world of keeping people safe, which is just so complicated. So thank you, everybody. And that will wrap it up for us. We'll get from Trish her links, and we'll send out the webinar information tomorrow to everybody. Thanks again, and appreciate you joining us today. And thanks, Rebecca, and thanks, Trish.
Thank you.